In this section, I will attempt to provide a framework for your discussion with the patient once you and the primary care physician have decided that the patient has capacity and should have a healthcare proxy conversation with you. The conversation can happen before or after the patient's visit with the primary care physician. I will go over some pointers for the conversation, which is not just a difficult conversation, but also not a usual one for a patient to be having. The first part of the conversation, of course, is the most important part. It's about introductions. Introduce yourself to the patient and specify that you are talking to them on behalf of their primary care physician and at their request. This will help the patient to find a familiar point of reference and also reassure them. You will now be established in their circle of trust. The conversation itself should be simple. And simple just doesn't mean avoiding scientific words. It also means avoiding long and complex words where possible. Allow for plenty of pauses to allow the patient to assimilate the information and also to ask questions. Organize your information into small blocks to allow for confidence and comprehension on part of the patient. Bear in mind, many of our elderly patients, even those with hearing aids, are not as comfortable talking in a noisy clinic setting. Ideally, choose a quiet area, but you will most likely be having your conversation either in the exam area or with some background noise. I'm confident every single one of you can have a good, simple, engaging conversation to get a healthcare proxy. Good luck.